Fever is a symptom that commonly occurs in boys and girls when there is an infection, as it helps fight the infection by activating the immune system. Additionally, by raising the body's temperature, a significant number of harmful microorganisms can be eliminated since they survive less at higher temperatures. In this video by AllForBabies, we will discuss when a fever is considered in babies and children, when to worry, and how many days it is normal for babies to have a fever. At what temperature is it considered a fever? We should always take the temperature with a thermometer. For babies under 3 months old, it is recommended to take the temperature rectally, up to 3 years old rectally or axillary, and for older children, it can be measured orally or axillary. There are different degrees of fever, and according to the Spanish Association of Pediatrics, they are classified as follows. Normal temperature, from 36 degrees Celsius to 37 degrees Celsius. Low-grade fever, 37.1 degrees Celsius to 38.1 degrees Celsius. Mild fever, 38.1 degrees Celsius to 38.5 degrees Celsius. Moderate fever, 38.5 degrees Celsius to 39 degrees Celsius. High fever, 39 degrees Celsius and above. When to worry? If the child has a fever below 38 degrees Celsius, we will act according to how they are feeling. If they seem well and play normally, there is no need to give them any medication to reduce the fever, as lowering the temperature could allow microorganisms to multiply. It will be sufficient to maintain a well-ventilated and not overly warm environment, dress them in light clothing, or give them a lukewarm bath. We will need to consult with their pediatrician in the following situations. The baby is 6 months old or younger. The child is under 2 years old and has had a fever for more than 2 days. The child is over 2 years old and has had a fever for more than 3 days. If we notice significant changes, they appear listless, more sleepy, irritable, or continuously crying. They eat or drink very little. They also have vomiting or diarrhea. Or if they show any other symptoms that we do not consider normal. And in more extreme cases, when we should go to the emergency room, the following apply. Fever of more than 40 degrees Celsius that does not decrease with antipyretic medication. High fever along with serious chronic conditions, such as immunodeficiencies. Difficulty breathing, bluish skin spots, or struggling to stay awake. If petechiae appear, dark red spots that do not disappear when the skin is stretched. Stiff neck. This is an urgent symptom to consider, as it could be meningitis. If the child is older, we will ask them to flex their neck downward to see if they have difficulty bending their neck or experience pain. How many days of fever is normal? The duration of the fever will depend on the underlying cause. If they received a vaccine that day, it may cause a reaction in the body resulting in a fever, which usually does not last more than 48 hours. If it is a viral infection, it is normal for the fever to persist for 2 or 3 days. If the infection is bacterial, the fever will remain until the bacteria is treated with antibiotics. In other cases, it will depend on the specific condition. We hope that this information about fever in babies and children has been helpful to you. If so, give us a thumbs up and share your contributions in the comments. See you in the next video by AllForBabies.